KB, Winter Garden, Orlando.
Welcome to another edition of Real Family Talk. Hello, 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 hello. Welcome to another week of Real Family Talk. This is your host, Jay Real. Hope everybody's having a great Tuesday evening out there. It is a pleasure to be here with you again on this Tuesday evening. Let me go ahead and welcome, we got some guests in the studio tonight. Let me go ahead and welcome the panel, though. Jeremy's in the building. How you doing tonight, Jeremy?
I'm good. How y'all doing out there?
Awesome, man. Mr. King's in the building. How you doing, Mr. King?
All right. I'm blessed and ready for Tuesday.
Awesome, man. Miss McCrae's in the building. How you doing, Miss McCrae?
It's Tuesday.
It is Tuesday, Miss McCrae, man. I'm excited. We got a great show lined up for you tonight. I guess they stepped out for a moment, but they will be back. Miss Jasmine Burney's in the house. We're going to have a special edition of Moment with Jazz. She usually comes on the first Tuesday, but she's back on the fourth Tuesday, I believe.
Yeah.
I can't even keep up no more. But she's here. She'll be joining us in a moment, man. As we do always during football season, man, we got to acknowledge
the Steelers.
Football this weekend.
Oh.
See, some people probably thought I was going to be afraid to talk about the Steelers.
I'm
but
just
I am
saying.
not.
I was wondering.
I'm not afraid to talk about the Steelers.
If you're gonna
I still
say
love
something.
the Steelers. We're struggling bad. I mean, the game against Chicago the other night was just depressing. I went to the store, and it looked like it was about to be a runaway. I came back from the store, and then the game we were within a touchdown of the score. I was like, okay, 20-27. Okay, I thought we was going to come and show up tonight. And then it just happened.
No.
It's like, I blinked my eyes, and the score was like 40. And I was like, what, 40? That's all right, man. It may be a rough year for the Steelers this year, but that's okay. The thing I love about the Steelers, we may have a down year, but the next year is usually better. It's kind of tanking. We kind of had a down year last year.
No.
And it didn't play out this year. But
No.
3 years in a row, it's
Yes.
not going to happen 3 years in a row.
We'll see. The thing about
It's
it
not
is
going to happen 3
the
years in a row.
Steelers are kind of what you would call old in football years. So they're kind of done. You got to look at teams like the Lions, teams like the Vikings, teams that you didn't look at. Everybody is expecting the Steelers because they're so used to it, but everybody has their down years, like the Cowboys. The Cowboys they had a long down, years, but, that's what they saying. They saying the same thing you saying, Brother Real. They saying, we going to come back and, we're going to get a team and we're going to get a stadium first and then we're going to get a team. But the Steelers, y'all going to have to get a new quarterback, and a whole new offense, new defense, and then they will have a good comeback. But I really want to give a shout out to the Manning fans out there. Peyton Manning had a great game.
As they beat up your Steelers, by the way. I mean, your Raiders, I'm sorry.
And I see what happened was. Okay. Peyton Manning is my favorite player. So that outruled my favorite team.
Okay.
You know what?
See,
If Terrell Pryor wouldn't have got a concussion, we might have came back.
He played the whole game. What you talking
No,
about?
he did not play the whole
When did
game.
he was out like the last 3 minutes of the fourth.
Of the third.
Is that when he got hurt?
He got hurt in the last 3 to 4 minutes in the third. He didn't play the fourth quarter.
It wouldn't have mattered.
Yeah.
It would have, because he was ready.
I don't know.
I saw it in his eyes. I didn't see it in Ben's eyes, but I saw it in Terrell's eyes.
In his eyes.
What you saw in Terrell was that cold that he ain't wipe out when he was taking a nap before the game, having nightmares about Peyton Manning.
Not worried about that at all. But I do want to give a shout out to those Bronco fans out there. The Broncos are looking like the Steelers wish they looked. That's how the Broncos are looking right now, because the Broncos are looking good, honestly.
Broncos do look good, but
Broncos are a Super Bowl contending team, and really, I don't see anybody, not the Patriots, definitely not the 49ers, not the Saints. I don't see anybody besides the Broncos beating the Broncos this year. They got the offense, they got the defense, they got everything that your team wish had.
Is he a Raiders fan or a Broncos fan? I'm confused.
I'm a
right
Peyton
now.
Manning.
I'm trying to
Peyton
figure it out.
Manning and Mike Vick. Wherever them two go is where I go.
I'm gonna tell you like this, bro. Peyton Manning is a good player, but the last thing I'm going to do is tout how great Peyton Manning's team is right now, dog. But that's all right, brother.
I've been with Peyton Manning since he was a volunteer at Tennessee. So that's all I'm trying to say.
You do what you do, brother. I appreciate it. I appreciate it, man.
If my team was losing like yours, I'd be saying, well, it's cool.
Steelers.
It's all good, man. Everybody has a down year. This is that year. We'll get through it.
Y'all the new Cowboys.
And we'll be all right. We'll be all right. We'll just count and just stare at our 15 championships, and we'll be okay for next year.
That's what the Cowboys saying.
Yeah. The Cowboys wish they had 15 championships. But we'll move on, man. We'll go ahead and get to talking to our guest, man. We're going to dedicate some time tonight. As I'm sure most of the world knows, the Affordable Health Care Act is upon us. We are just a week away from seeing these exchanges, these health exchanges, take place and open up for people to sign up for the Affordable Health Care Act. And we have some guests here tonight that are going to come and discuss it with you, answer questions for you as well, as we take and examine what changes and what to look for as we embark upon this new achievement. As I said earlier, Miss Jasmine Burney's in the house tonight. How you doing, Miss Jasmine?
I'm doing well. How's everyone doing tonight?
Oh, we're doing pretty good.
Good.
We're doing pretty good. And joining her tonight to also discuss this this topic is, and I apologize if I butchered his first name, but is it Juanica? Is that how you say it?
That's
okay.
pretty good.
Juanica Fernandez is here with us tonight as well to discuss the Affordable Health Care Act. So thank you for coming tonight, Juanica.
Anytime. Thank you for having me.
Oh, we appreciate you. We appreciate you. So I've made a promise to myself on the way in, Miss Burney. We've talked about this topic before. Mm-hmm. I know you know, and Miss McCrae can attest that I just love the idea of this Affordable Health Care Act.
I can imagine.
And the achievements that it will be. I think, is this not the greatest achievement since electricity, I believe? But I have made a promise to leave the politics out of it tonight.
Uh-huh.
And we'll just discuss its implementation and what it means for the people. I made that promise. I'm trying to cross my fingers and stick to that. But let's get right into it, ladies. I'll go ahead and let you introduce yourself, Ms. Fernandez. We're real familiar with Ms. Burney. But tell us about you real quick.
Let's see. I don't know. Previously, I was actually the Deputy Regional Field Director for President Obama's campaign for Central Florida. And now I have put on my nonpartisan hat, trying to make sure that the Affordable Health Care Act is successful. So I work with Enroll America.
Awesome. 407-894-1680 is the number. 407-894-1680 is the number if you want to call in tonight. So just go ahead and just, I don't know who wants to talk first, Miss Burney, Miss Fernandez, but just give us a heads up as to what we should kind of be expecting next week.
So next week, October 1st, is the very big day that we have all been anticipating and waiting for, and to see what happens with the Affordable Care Act, also known as Obamacare for some of you who may be more familiar with that. And next week, enrollment begins. We go throughout the entire country signing people up to begin to receive health care benefits that can start as early as January 1st of 2014. And like Juanica said, she's working with Enroll America to make sure that this transition for a lot of people who don't have health care or who may be getting health care for the first time goes rather smoothly. And if you would, could you tell our viewers exactly what October 1st may look like for them and what they can expect to see or possibly participate in if they don't have benefits or would like to receive some?
All right. Sounds good to me. Well, there's 3.5 million uninsured Floridians right now, and when we did a poll a couple of months ago, it said that about 78% of them didn't even know about the healthcare exchanges. So for some of them, what it'll look like on Tuesday, October 1st, is maybe a lot of people getting out, knocking on doors, making phone calls, telling them where they can go in their neighborhoods to enroll. There's 3 ways to enroll. You can enroll on phone, over the phone, in person, or via the internet. So there's still a lot of outreach and education to do. So the weekend before October 1st and up to October 1st, you should definitely just see a lot of volunteers and staff members getting out tabling. I'll be at Take a Loved One to the Doctor Day, which is the Saturday directly before the 1st. So they should just see a lot of outreach leading up to that day. Now, October 1st isn't the end-all, be-all, but there'll be a lot of different volunteer efforts on that day.
Okay. Now, what exactly would people be seeing as they enroll for this healthcare program? I understand that you have navigators who are going to be out there. What are these navigators? What's their role? And what will these navigators be able to do? And what are some things they may not be able to do? Because if you're a first-time person signing up for healthcare, there may be questions that these navigators may not be able to assist and help with. Mm-hmm. So what's exactly their role in this process?
All right. Well, navigators are people who have applied for federal grants to be able to assist people, walking them through the process. Like you said, a lot of people that haven't had insurance before may not know what a copay is or a premium or these different things. So they'll be there to walk them through that. Now, never before has there been one place where you can see all the healthcare plans and pick and choose what's going to be right for your family. It's like comparing apples to apples, oranges to oranges. You can see what all the copays are, what all the premiums are, what they cover, and they'll be there to walk you through what all those things mean for you and your family.
So you say there are going to be a variety of different packages or plans.
Mm-hmm.
So we can pretty much pick and choose or personalize what we want our plan to look like?
Definitely.
Okay. So what are some of the things within these? What's a combination of maybe a family of 4 could possibly get?
So that's definitely a question you would want to ask a navigator, only
Okay.
because this is so specific when it comes to healthcare and there's so many different options. I wouldn't want to lead anyone astray. But what I can tell you is it's comprehensive healthcare coverage. So everything you need, from maternity visits, prescription plans, emergency room visits, all these things are covered. And now it has to be complete healthcare. So we're going to see this is not just for the uninsured, but also for the underinsured. They're going to be able to take part in the marketplace. So this is going to be something where they can pick whatever's good for them and their family.
Okay. Anyone else have any questions?
Yeah, I have a question. So one of the things, obviously, the whole idea is that this is going to be more affordable for people. Are there any ideas right now as to, cost associated with it, and just to have ballpark figures of what people should be expecting to kind of pay for some of these plans? Is there any idea out there about that?
So definitely. There's 2 things I'll say to that. The first thing that I'll say is because healthcare is so personal and private and everybody has so many different family makeups and needs, I would recommend that you go to healthcare.gov. And if you go to healthcare.gov, they have a link at the bottom to Kaiser where you can kind of play around with it and see about how much you'd be eligible to have to pay or eligible to receive for financial aid. So that's one great resource for people. But what I can say, the second thing I wanted to say is if you're a single person and you make up to about $40,000, you could be eligible for financial aid. And if you're a family of 4 and you make under $92,000, you could be eligible for financial aid.
Now, what's financial aid?
Or stipend, or...
So they assist in paying for your health care benefits?
Right.
Oh, okay.
Mm-hmm.
Okay. Now, is there a base that we would all start off with? And then from there, would we add on different coverages that goes back to that personalized package?
So this is 2 parts.
Okay.
So that's a great question. Everybody that has health insurance as we know it now, it's going to change a little bit. Only because there's some things that are kind of going to be prehistoric terms when this rolls out. Like things like pre-existing health conditions and lifetime caps. These things aren't going to be existing anymore. So everyone's going to have to provide complete coverage. So what we all start out with is complete coverage. Our prescriptions being covered, our visits being covered, preventative health care, and these things are all covered under the basic plans. So we kind of all start out with comprehensive care that meets the, I think it's 10 points of health insurance.
Wow, that's really good and good to know. Now, let's say you are a single individual. You are, like myself, single, just transitioned off of my parents' insurance because I turned 26. I'm looking to sign up for healthcare insurance. Where would I find a navigator? Where would I go to find someone to help me sign up to get health care?
So that's a good question. I'm always going to recommend that you try our website.
Okay.
GetCoveredAmerica.org, healthcare.gov, and Kaiser. Now, the reason I'm sending you to the websites and not telling you specifically where to go is because they haven't actually released the names of the navigators and where they are specifically. And the navigators are also working with in-person assisters and community partners that are going to be able to enroll people like Planned Parenthood, and maybe, for an example, the local Boys and Girls Club might be people that are certified to be able to actually assist people in the neighborhoods, but they haven't released a complete list yet. So until that day, I would just recommend watching those websites.
Here's another question. Here's another question for navigators. I know that in the state of Florida, our governor has an issue with us navigators collecting information because they're unsure where this information is going to go. Is that something that we need to worry about signing up at our local Boys and Girls Club or signing up at our local community center? Should we be worried about providing this information to them?
No, there's two things I'll say to that. I know I answered that way, but first thing is that's why people like me at Enroll, we're just doing outreach and education and not actually enrolling. They've taken great measures to make sure that these things are separate. They are abiding by the HIPAA laws to make sure people's information is private and confidential. So it would just be like if you apply for any other government assistance and filling out the information, it's the same process. Now, I will say that this has also been shortened a little bit in that they're going to be pulling information that they need based on a system that they already have information from. So you even need less information than if you were applying for another type of public assistance.
Okay.
So it should be a lot easier than before, one application and a lot less information to actually put in.
Wow. That's really good.
I'm sorry, y'all talking real fast. I understand it's a lot of information, but everybody isn't as smart as y'all, and I'm definitely one of those people. I don't know nothing y'all just said, and I'm sitting here in the room with y'all. So I'm going to start at, what's the websites where I can go see this information again? I know Kaiser. That's the only one I know of because that's the one I'm familiar with, but the rest of them, I don't know what you were saying.
All right. Well, so one of them is healthcare.gov.
Healthcare.gov. Okay.
That's a great site. Another one is www.getcoveredamerica.org.
Getcoveredamerica.org. Okay.
So, and you know the Kaiser one.
Okay.
So those are three great ones to start with. Okay. Now, you said that I went too fast and you kind of didn't know everything I said. So if you don't get anything else from what we're talking about today, I want you to remember 4 main points that kind of encompass about 89% of people's things that they need from the Affordable Health Care Act. These are the main things that you want to take from this. One, the insurance has to cover the basics. And some of those basics are like doctor visits, hospitalization, maternity care, emergency room care, prescriptions, and more. Okay?
So the insurance has to cover the basics.
It has to be complete coverage.
Okay.
That's one of the things, right? Okay, so the second thing is insurance can no longer deny people if they have pre-existing conditions. So that's important, right? Very important. Okay, because some people say, I can pay for my own insurance, but they won't give it to me because I have diabetes or I have some kind of issue. That can never happen anymore.
Oh, okay.
So that's awesome, right?
And that's not only with the Affordable Care Act, that's with any healthcare agency now. If you decide to stay or transition, every healthcare agency has to abide by that.
So the Affordable Health Care Act makes that the law, right? Okay, and so another thing is there can be no fine print. They have to explain things to individuals who are enrolling in these marketplaces in easy to understand language. Clear, easy to understand. Someone's going to walk them through it, okay? And then the fourth thing is, this one's the easiest one, the Affordable Health Care Act. You might be able to get financial aid to make sure that you can afford the cost.
And she explained what financial aid was, right?
Right. Like
can you do that again, too? Because I remember when I hear financial aid, I just think free money. I'm not for sure, but can you explain the financial aid part again?
I can. It's a little in-depth.
Okay.
But what I will say is this, to make it brief.
Nutshell.
That it's kind of like receiving a subsidized portion of your health insurance. So for an example, it goes on a sliding scale depending how much you make. And depending on how much you make and the size of your family, they might say, okay, well, this person should only have to pay $2,000 of the health insurance instead of the $4,000. The $3,000 or the extra $2,000 is applied by the government given directly to the health insurance plan through a tax credit. You don't have to wait until you actually file for your taxes to get the tax credit. It's immediate.
So what you're saying is that if I, depending on them, they decide if I can get the money immediately or it waits, or
you can get it immediately. I'm saying you don't have to wait to file your taxes. So when people say tax credit, you're thinking in January when you fill out your taxes, you're going to get the money back, right? So I just want to clarify that it's a tax credit. That's what they're calling it. However, you don't have to wait till you file your taxes to get it. When you do your application and they tell you what amount you're eligible for, it's an immediate credit that goes towards your premiums.
Oh, okay. Oh, so you don't get cash. It just goes towards your insurance.
It's for insurance.
Oh, I got you now. Thank you.
You're welcome.
407-894-1680 is the number to call in the show if you have questions. 407-894-1680 is the number. You know, I was reading about that whole, you know, that seemed kind of, I don't know, tricky to me that they're going to somehow manage to, based on your income, automatically apply credits to your premium, so that the premium you actually pay would actually be reduced. I was like, because I was curious about how they were going to provide these subsidies, if it was coming on the back end or the front end. I don't know if you know the answer to how they're going to do that, but I am curious to see how that works, because that just definitely sounds tricky.
So the answer is it's on the front end.
Right.
When you're applying, they're going to know right away. And you're asking me, well, how do they know, right? From your income tax that you filed.
Because it's automatically, reading back.
But see, that's a loophole, though, because a lot of people aren't truthful on their income tax. So if you're making less money on your income tax, won't you get more on your insurance?
You said they are truthful? And
no, if they're not truthful.
Oh, so
if you're saying, oh, I didn't make that much this year.
Okay.
Right.
So that's like, we're going to get in the weeds, I feel like, right now. But that's kind of like saying some people aren't truthful when they apply for other subsidies, right? You're right. That's going to happen. People abuse the system all the time. And we haven't worked out all the kinks, right? This is just something that we're putting forth that's never been tried before. But definitely, if they can't verify what you're giving them, they have other ways to verify it. So they're just going to take the information, and unless there's a problem, they'll approve you right then and tell you what you're supposed to be doing. But if they need other information from you, they'll request it at that time before they just approve you.
But it's no cash at hand. It's just insurance credit. Oh,
you're not getting any money.
Not no money.
But you get health
Mr. King want a check.
insurance.
I need a check.
407-894-1680 is the number. 407-894-1680 is the number. Now, as far as the actual paperwork itself, what can people expect to need to information they need to supply to the government in order to be able to figure out where they stand?
All right, that's an awesome question. So, like I said before, I don't know if, when I was in college, I applied for food stamps, right? And when I did, they said they needed they needed to know what classes I was in, they needed my license, a copy of my social security card, they needed to know all this information, right? And they compile all this information, and then they come back and tell you get $50 or something like that. So with this system, they're just going to ask you some simple questions like who's applying for coverage, what's the income, the number of people in the house, your citizenship or your immigration status, and if you have affordable coverage now. They're going to pull from the information that you're giving them information that they already have about you. So they're not going to require all these extra documents, this folder of stuff to go ahead and approve you, because they're pulling from one single system that has the information. So what do they need to bring with them? They need to bring the stuff that's going to identify them, like their ID, their income, and the number of people in their homes, but not as much stuff as we've seen in the past.
Oh, okay. So if you're talking about if you're doing it in person, online, you could just, again, but I guess the bottom line is they're going to basically connect back to your social, which obviously they have on file from your taxes this year or last year. Okay. All right, so seeing it's one of those things. I said I'm leaving it out though, Miss McCray. I am leaving it out, Miss McCray. Leaving the conspiracy out. 407-894-1680 is the number. 407-894-1680 is the number. If you have a question about the Affordable Health Care Act, we're here talking with Miss Juanica Fernandez and Miss Jasmine Burney as they kind of break down some of these details for us. October 1st is the date. So obviously that is the initial date you can begin applying. Does that period extend beyond the October month, or how does that work?
Yep, open enrollment is until March. So you have an extended period of time to actually enroll, and that's just this year because they've allowed an extension. So they, like I said, open enrollment is starting October 1st, but that's definitely not our deadline. We just want to get the word out to as many people as we can and make sure we get as many people enrolled as possible. But we do have, ways to go to make sure everyone can get enrolled.
Awesome.
Now here's a question, and this is the other part of the Affordable Care Act. In the event that I decide not to enroll, I choose not to get health insurance, I choose not to do anything, I don't need assistance, I could care less about this process, I go to file my taxes and I get a penalty on my taxes because I don't have health insurance. Why am I getting this penalty? What does this penalty mean? What can I do to rectify the situation?
You could get some health insurance.
I can get some health insurance.
No, I'm just kidding. Okay, well, I mean it, but what I'm saying is, what I tell people is, my own mom said this to me. I don't want people making me get health insurance, right? And so I went through this big whole long spiel about how, when you don't have health insurance, you don't take care of yourself and you end up going to the emergency room, and that's why I pay $25 for an aspirin because of the hospital absorbing all these costs, right? And she still didn't want to hear that. So then I said, do you pay your car insurance every month? She's, of course I have to pay car insurance. I said, you have to pay car insurance every single month, and you're only going to use it if you get in a car accident, right? I said, well, you're going to pay for health insurance, but you're going to have the benefit of making sure that you have preventative health care, that your prescriptions are covered. This is the law of the land. It's not an option. And just like I don't like paying my car insurance every single month to protect everyone else around us, we have to pay it. And it's the same thing. You're going to protect yourself by paying this health insurance, and you're going to protect everyone else from having to absorb costs.
I see we have a caller. How you doing tonight, Ed?
I'm doing good.
Awesome. What's your question tonight?
I got a unique situation. I'm 64 years old. I'll be getting, Medicaid next year in March. My wife is 57. And then we have another young lady staying with us who's receiving disability, Social Security, because of a disability. So I'm trying to figure out, would I have to have one policy for everybody, or how are we going to put that together?
All right. So that's an awesome question. What happens is we always encourage everyone to apply. Put everyone in your household on one single application, and once you put everyone in your household on one single application, the system will decide, either if you go online or over the phone or in person, however you do it, it will decide where each person is supposed to go. So for an example, let's give an example of a family of 4. All 4 of you might be on one application and apply. It might say the children need to go to a kid care, and the mom needs to go to Medicaid, and the father needs to enroll in the marketplace. So even though you guys are on one single application and that's all it takes now, the system is going to tell you which thing you're eligible for, each individual person in the home.
All right. You got any other questions, Ed?
Okay, I have to figure it out.
Did that answer your question, Ed?
Yes. One application.
One application. Everybody apply. It'll tell you where you go.
So basically, it's,
thanks, Ed, for calling.
Thank you, Ed. So it'll sort out everything from the information of each person that you put on the application.
That's right.
Oh.
Mm-hmm. And some people, your coverage may stay the same. You may stay on Medicaid, Medicare, based on your income, or they may suggest that the marketplace is a better place for you to be at based on your income also. Mm-hmm. It just all depends.
What is the marketplace?
The marketplace is the Affordable Care Act. That's where you would do your enrollment. It's like the title of the health care insurance.
So the marketplace is not a place. It's a figure of speech. It's like when you think of a marketplace, you think of like apples and oranges and all this stuff where you can pick what you want to pick, and That's kind of the idea. They want you to get the idea that in one place is all these insurance plans where you can pick and choose what you want and what's best for your family.
I heard someone else explain it. They kind of compared it to, like an Expedia kind of website, so that you go on, you put on your information, and then all of these different plans come up. They show you all the different prices, and then like Expedia, right? You're looking for a flight, and then you just look at the carrier that has the price you like, and then you kind of pick it and choose it as you so desire.
What is Expedia?
Expedia.
I was about to say.
407.
This is going to be a deeper conversation.
407-894-1680 is the number. 407-894-1680 is the number. I have a. Oh, you got a question?
I got a question on Facebook. Someone asked. Let's see. Okay, how is the Affordable Health Care Act going to help them? Someone who's unemployed who can't get affordable health coverage. They got a quote from a company. It was $400 a month, and that wasn't affordable for them.
Mm-hmm. Well, to be honest, this is the elephant in the room that I will just go ahead and address.
Mm-hmm.
Florida did not expand Medicaid. So what was supposed to happen was for people who were not going to qualify for the Affordable Health Care Act, when Medicaid was expanded, those people would be covered. We didn't expand Medicaid in Florida, so unfortunately, a lot of people are going to still be unable to afford the health care. They can definitely take part in the marketplace, but like you said, the premiums might still be too high for people to afford.
So then we'll still have to pay a penalty.
It's not a penalty; it's just the cost. But the other thing too on that, I know
she didn't answer my question.
Oh, go ahead.
Thank you.
You shouldn't interrupt him.
No way. So we still have to pay a penalty, is what you're saying?
Actually, what I'd like to do is parking lot that. Let me tell you I don't know, and let me get back to you.
Oh, okay.
Okay, go ahead.
But the legislators actually, if I'm not mistaken, up this week the topic of whether or not to expand Medicaid again, and so I don't know how long they'll sit up there and debate the issue. It is the Florida Congress who is still mostly Republican, but we'll see what happens, brother. But they are debating that issue this week to kind of take it up and see if one last effort can be made to actually bring, I think it's $51 billion that's on the table.
And because Juanica is in a nonpartisan position, I, however, am not and work for myself, and so I can say what I please. And so extending that is slim to none here in the state of Florida. Our governor has already put out a number of different statements about how we aren't able to have navigators at health departments, how he's going to figure out a way to not even allow people to sign up for the Affordable Care Act. A third of the people in Miami right now don't have health care, and he's doing everything in his power, along with legislators, to make sure that this does not come here to the state of Florida. So there's no likelihood he's going to extend Medicaid, even in this special committee week that we have going on in Tallahassee. Number one, there's just not enough time to get an agreement, although they've had the entire summer to discuss negotiations and what possible resolutions could be. It's not going to happen, unfortunately. When it should have happened, it didn't, and that was during a legislative session earlier this year. We'll go into legislative session again, but by then, we'll already have this program up and running and started. So it'll be tricky. So what I suggest everyone go ahead and do is sign up to go to, well, what you can do is you can contact your legislators. That's one thing. You can contact your legislators, call them, you can send them emails, you can send them letters, blast their phones with your either disgrace for why they aren't supporting supporting extending Medicaid expansion here in the state of Florida, or thanking them for either being supporters. You need to also vote. We have an election coming up next year, so our governor is up for re-election. That's another thing that we need to talk about and worry about. If he's the one who is taking away your right to affordable health care and taking away your ability to gain access to health care, then we need to take away his right and ability to access the way we live here in the state of Florida. So those are a few things. But in the meantime, in between time, there are other options, and the Affordable Care Act is one of them that we can still take advantage of.
So you say we should write our legislators?
Write your legislators. Let them know exactly how you feel. If you were someone who knows that you cannot afford the Affordable Care Act, even if it's at the lowest possible rate, you know you can't afford it, and you would have probably been one of the millions of people who benefited from Medicaid expansion, you should explain to your legislators how they should have extended that for you and your family. You can call them and share that same sentiment.
And by legislators, you mean?
Your Florida House of Representatives and your Florida Senate members.
Right. And you can go online and look
you
those
can go
people up.
online, simply enter in your zip code to find your Florida legislator, and it provides you a list of everyone that represents you where you currently reside at.
Yeah. There's even a couple apps out there that if everybody has a smartphone, but there's a couple apps out there that you can download, and it'll take you right to your legislator as well. So there's a lot of different ways you can do that, and I won't advocate for anybody. Not gonna do that, but yeah, definitely. Whatever your opinion is, you gotta call them. You gotta keep in contact with your legislator and let them know whatever it is you feel needs to happen, whatever side you're on. So definitely, man, definitely. So we'll see what happens. I was wondering how the idea that the Florida will not accept this extra Medicaid money would affect the citizens of this state and their ability. So I from what I understand, I guess they're going to be state exchanges, and then there'll be federal exchanges. So if you're in Florida, I guess you'd have to participate in the federal exchanges that are out there. Is that kind of the idea?
That is the idea, but really when it comes to what the consumer has to, like how it pertains to the consumer, there's no difference. If they would have accepted the funds, that just would have meant for us that we had those funds. This is a specific program tailored for Floridians. So even though the federal government would be running it, technically, like you're asking, it's still Florida's plan. Just one thing to piggyback off of Jasmine's statement, I definitely want to just admonish people, if the Affordable Health Care Act is going to help you, having positive stories as well. Like if you can send those to me, I'll give you guys my email address. It's Fernandez, Fernandes @enrollamerica.org. Those positive stories are things that we want to uplift and triumph as well, because I know we see a lot of negative things in the news, but I was canvassing, and I ran into a guy that said, my wife hasn't had health insurance for 6 years because she has a pre-existing health condition. I'm a veterinarian. I still can't afford to put her on my health insurance. And I'm looking forward to October 1st because this will be the first time my wife has been able to have health insurance in the past 6 years. Those kinds of things are the things that we want to definitely lift up and send up so that we can highlight these things and combat some of the negative things that we're seeing.
Awesome. 407-894-1680 is the number. 407-894-1680 is the number. Just to repeat your email address one more time for me.
It's J, like Jack, Fernandez, FERNANDES @enrollamerica.org.
Enrollamerica.org. All right. So that's awesome stuff. I tell you, man, if I didn't know what I know in the back of my head, I would certainly jump on board with this thing. I swear. But that's all right, man. We're gonna press forward. This
is why people have options.
Yes.
And why it's important to educate yourself on what all those options are.
I agree, Miss Burney. I agree wholeheartedly with that.
And so that'll help all of us move forward in decision making. But there are some people who just aren't given those options and just don't have the know-how or the wherewithal. And so you have people like Juanica who can come on in and enroll them in the Affordable Care Act. Now, here's a question, or people that can educate them on that process, on how they can get enrolled.
That's right.
But here's a question. What if our viewers were interested in helping you in your outreach efforts, helping you to talk to people, telling you about events and things of that nature, and tell us also where you'll be so people can ask you more questions if they have them and don't have access to email you.
Okay. Well, if you don't have access to email me, should I give my number out?
No.
No? Okay. Well, what you can do is I'll be at Take a Loved One to the Doctor Day.
There you go. That's how
I'll be there this Saturday from 10 to 2, reaching out to the community. It's at Barnett Park. And I'll be there from 10 to 2. I'll give couple of different seminars and question and answer period. So that's one thing. Also,
Are you guys going to be in the gym area?
Yes.
Okay.
Also, getcoveredamerica.org. We have events on there. There's a tab on the right-hand side. You can click on events, and the events that I'm having, I usually upload them. So you can definitely try to attend one of the events. Or I also gave you my email address. Email me, and I can definitely tell you where an event is in your area. If it hasn't been uploaded, I can tell you, hey, we have this going on. I need as much help as I can get. So
Do you have a Facebook?
I have a personal Facebook, but Enroll America does have a Facebook. I know that you guys are probably looking at me thinking that I'm young and I should be very versed in this, but I'm not. But we do.
Well, no, a lot of people are on Facebook, and different events pop up on the wall. So
yeah, we do have Get Covered America. We do have a Facebook page, and you can sign up on their email list, and you can see the events, and you can get a twibbon and put Get Covered America on your Facebook, and we do Twitter, and it's Twitter at Covered America. Nobody does that. Oh,
Nobody uses Twitter anymore?
No, it's all Instagram now.
Oh, see, I'm really out
Some
of the
people
loop.
use it.
Some people use Twitter.
Everybody in this room is over 30 except me.
Yeah, and I understand that, and we the people who can afford health insurance. So that's why we on Twitter. So
Because y'all all got kids.
But Twitter is important. That's what I'm saying. Just because the kids don't use it.
Yeah. So those are the places. You can do our website, www.getcoveredamerica.org. For the people who still tweet, is that what? You can do Twitter at Covered America. And you can like our Facebook page at Get Covered America Facebook page. Sign up for our email list, all that stuff.
And for everybody who's not a baby boomer, they will have an Instagram pretty soon.
I will take that back.
407-894-1680 is the number. Like I said, we are here talking with Miss Jasmine, Burney, and Miss Juanica Fernandez, talking about the Affordable Health Care Act and its implementation, which begins on October 1st. We've been discussing the process, what you need to do with the marketplace. We kind of summarized, and just to kind of, I'll steal I've heard a saying on somebody else's show. He said, you got to put it where the goats can get it, is what he likes to say. But basically these exchanges are going to be like a Expedia or an Orbitz, where you'll put in your information, and then it'll spit back several options, show you the prices of all of these options, and then you're allowed to pick and choose the option that you feel is going to best suit the cost that you're looking to pay. And then she's also explained to us as well, for those of us that may qualify for some kind of subsidy, the program is going to spit back that information as well and automatically let you know what kind of subsidies you qualify for, so that when you sign up for your plan, it immediately takes into effect that discount or that tax subsidy that you're going to get from the government, which will automatically be paid to whatever insurer you end up going with. And then just the last big point here is, how do they know your information? Basically, obviously everybody has a social. They're going to connect their social basically back to information you've already given them in the past, related to your tax information, and sort of verify you say what you said was true. And then all the information that they give you is going to sort of be based on that information. So
it doesn't matter if you have a felony or anything to that nature?
No, as long as you're not incarcerated currently, and you are a citizen or an immigrant who's legally in the country, you can enroll in the marketplace.
Yeah, because I know in Florida we have a lot of immigrants, or people that came over to the country, or they were born here but their parents aren't from here. But you do have to have a green card or something to that nature?
Well, so that's a specific, green cards are specific, but as long as you're in the country legally, whatever you have, then you're eligible.
Here's a quick question, and this has to do with business owners who will possibly have to insure their employees. Very briefly, small, just want to touch on it really quickly. What would they need to do if they had to provide healthcare benefits to their employees? Would they provide them the option? Would these employees stick with the current carrier that the employer has? How would that work?
So definitely I'm not the best person to ask about small business owners, but that site that I gave you before about healthcare.gov, they have a great section on there for small business owners. And because it's so specific, I definitely direct anyone who has a small business to that site so that they can find out the ins and outs and how it'll affect them, their business.
Great. That's good to know.
Awesome. Yeah, healthcare.gov, right? Healthcare.gov. Yeah, they have a lot of information. Surprisingly, the website I've been is pretty nicely put together.
It's friendly, right?
Considering it was made by the government. But it's pretty nicely put together.
So you know they watching.
They're trying to make it user-friendly.
Yes, I saw Miss Burney. I saw 407-894-1680 is the number. 407-894-1680 is the number. I see we have a caller. How you doing tonight, Miss Ruby?
Hey, babies. How y'all doing, sugar?
Hey, Miss Ruby.
Miss Ruby doing good. I just told you it's a good show. A good program.
You gonna get health care insurance, Miss Ruby?
Oh, I got plenty of it, baby. These are for some of my husband.
All right. What's your question tonight, Miss Ruby?
I was just calling to tell you a good show. That's all. Just encourage you,
Oh,
baby.
we appreciate that, Miss Ruby. We thank you for calling in and letting us know that.
All right, baby. Bye-bye.
Thank you, Miss Ruby.
Bye, sugar.
We love Miss Ruby on this show. She's one of our favorites. She calls in and she listens all the time, too.
Good.
She is a stalwart of this station. Every show from morning to evening.
Oh, wow.
Yes, Miss Ruby. We like Miss Ruby.
Yes.
So
Baby.
this is definitely has been great information. Is there anything that you wanted to get out to the people that we haven't kind of brought across yet?
I think that you guys covered everything. Like I said, if you don't remember anything, those 4 key messages are the things that I really want to bring home and triumph. 1, you might be able to get financial aid to help you cover it. 2, all the insurance plans have to show the cost and what's covered in simple language, can't be any fine print. 3, if you have a pre-existing health condition, insurance plans can't deny you for coverage. And 4, insurance plans have to be comprehensive. They have to cover the basic needs, the doctor's visits, hospitalizations, maternity care, emergency room visits, prescription plans, and much, much more.
So what age do I have to be when I have to choose either get it or be penalized?
So that's like a specific question because everybody has different things going on. If like Miss Burney said, she's able to be on her parents' insurance until she's 26 years old. Mm-hmm. So technically she didn't have to enroll in her own health care, but she was covered. The idea of this is to make sure that everyone is covered under health care insurance so that we don't have to absorb costs and that we can be happy, healthier Americans. So these things depend on the individual.
So if I'm 18, I just graduated high school, and my parents don't have the health care insurance, am I liable to being penalized, or how does that work?
So what I'm going to do is tell you I don't know.
Okay.
And I'm going to ask you to go on healthcare.gov
okay.
and maybe do a little bit more research. Or when you speak to a navigator in person, ask them these more detailed questions because I definitely don't want to lead people astray with like different situations.
Okay. Because I just know a lot of people graduate and it's kind of like, I don't know, they're so used to what it used to be, and now that things are changing, we really have to start looking out for the seniors and the juniors that are going to be graduating and really don't have any idea. And some of them don't want to learn. They just feel like, they ain't teaching me in school, so it ain't important type thing. But, and a lot of parents don't teach the children this also. So I'm just trying to get a lot of more information so that I can pass that along to some of my younger peers.
Everyone should apply.
Everyone should just apply.
That's it. Everyone should apply. If they need to be on Medicaid still, they'll tell them. If they need to go to the marketplace, they'll tell them. If they can get, some other kind of subsidies or other programs, they'll tell them.
So at 18, you should be applying.
Just like we tell everybody to register to vote. Same thing. Get some health insurance.
Yeah, okay.
Good?
I'm with Jay Real. I'm sorry. In the back of my mind, I don't trust the government, but that's just me.
Are you insured?
I got car insurance.
Okay. You don't have health insurance.
Nope.
So the funds that they take from my taxes, the government, take from my taxes to use for you, the uninsured American who goes into the emergency room to receive the. You never go into the emergency room.
Never.
Never say never.
I haven't been yet. That's all. You said for the one who's
But
done
when
it,
you go, my money that the government takes from me is going to pay your health care coverage when you have to go to the emergency room.
Well, the other thing that I'd like to add to that is I think that, what's your name again? I'm sorry.
Mr. King.
Mr. King is speaking for a big demographic of people, and we call them the young invincibles, right? So they feel like this could never happen to me. But what I can say is that our trauma centers, actually a large percentage of the people who make up trauma centers, car accidents, and you might trust yourself, you know, that you're not going to get sick, but we can't control what other people do. Those are made up by young people, and a lot of them don't have health insurance. So we never know about these things that just come up unexpectedly. And how much do you think it would cost if, God forbid, anyone got in a car accident and had to be life flighted somewhere, or just spend one day in the hospital?
Right.
Not having insurance will bankrupt you.
That is so true. A younger generation doesn't think like that. But if you see John Q, I'm speaking for everybody when I speak. Okay?
Please don't do that. Don't do that. I'm good.
Pardon me?
Don't speak for me.
Well, no, I'm speaking for those who think like, I don't need it. You know what I'm saying? It's not everybody that doesn't think like this is a good ideal. It is some who feel like, I ain't listening to that. Right. I don't need no health insurance. I ain't had it so far. What I need it now for? I ain't never been sick, and I'm 26 years old. So, you know, it's a lot of people that think like that, but you know, they need to be informed also. So
it's kind of the same thing. Like, I hate to keep going back to the car insurance, but nobody wants to pay car insurance. But guess what? You have to pay it. And if you don't, there's a penalty.
Well, if you want to drive, you're right about that.
Right, if you want to drive. And you're speaking for young people. We know they want to drive.
Yeah.
So they're going to have to pay some car insurance, their mama or somebody.
Yeah.
So it's the same thing. We're going to have to be accountable for ourselves and make sure that we are living happy, healthier lives as Americans. And everybody tries to buck against change, right? That's something people don't want to do. It's uncomfortable. But this is change forward and in the right direction. So we definitely don't, we just want to make sure that we are encouraging everyone to take the right steps towards change.
I love that, not Tom.
Well, we'll like I said, we'll see. We obviously get to see its implementation with all of these different exchanges taking place starting October 1st. Now, one thing that I was curious about, you said the initial enrollment period goes through March. Is that to suggest that after March, April or so, is there going to be a second enrollment period? Is that sort of so that it's really kind of an open enrollment that really doesn't ever end, or like what's that process?
So it mirrors anyone who's had health insurance before. You'll have a period where you can enroll, and then you're on your plan for the year unless there's any kind of changes where you have to enroll not during the enrollment period. And then there's another open enrollment period where it starts all over again. So this is going to be the cycle, just like a regular
So the cycle
insurance.
will always theoretically be October to March.
No, it'll be October to, I think, January. It's only October to March the first year because there's an extension.
So it'll be October to January in most years. And so if you don't get it in by January, then you'll be stuck without it. And then if you don't get the insurance, you'll be forced to pay that penalty.
And that's why, because it's in January, we start our taxes. Tax season starts in January. That's how they'll be able to penalize or not penalize based on that information.
Gotcha. Seems always.
Really quick question. Will there be penalties next year, though?
I'm not sure.
Okay. We'll probably need to look into see if there'll be penalties next year. I don't think so.
Miss Burney. Really?
Because our government is great, and I don't think that they're going to penalize us.
They're going to let you slide on the first year, Miss Burney.
Yes.
There's a reason why it ends in March, Miss Burney. You know why it ends in March, Miss Burney. They take a toll. They would probably send out back checks. We noticed that your name never came up on the rolls anywhere. So we're going to pass out this delayed tax.
Here is your notice to pay your penalty.
Please pay your penalty because you did not sign up between October and March this year.
And they will be getting paid.
That's
going to be good money for the government.
Like I said,
just like insurance. You paying all that money, you don't even use it.
So that's
until you do need it.
Well, that's in
Until you
contrast
do
with
need it,
this
yeah.
one. because, like I said, preventative health care, things that you are going to need. So I definitely go to the doctor regularly because I pay health insurance every month.
Right. And some people do that. I'm one of those people that pays for the health insurance and then just,
As a woman, I definitely understand that. As a 50-year-old man, I definitely understand that too. But as a 26-year-old, 18, 19 through 30,
well, I can think of
guys really don't go to the doctor like that unless it's a serious situation.
Dentist, like you need health care. You need to make sure that you're maintaining your body so that when you are older and things happen, they don't just crumble. It's maintenance. Like you maintain your car, you get a tune-up, you get an oil change. These things need to happen to your body as well.
There's also one glaring thing that I can think about for young men that are young, why they probably should be going to the doctor at least every 6 months to make sure that they're keeping up on other things. So that's getting regular blood work and different things. So if a young man, even when I was in graduate school, tells me he hasn't been to the doctor in 5 years,
Red flag.
That's scary.
I'm backing away. Nice
That's
to
because
meet
y'all are
you.
active. When you in
No.
Christ, when you in Christ,
Well,
you don't have to worry about
Jesus, hold on, I got married at 18.
that.
You know what?
Thank you, Jesus.
Okay.
Get out.
'Cause I'm in
Get
Christ.
out
I don't even-
right now. Get
I'll tell
out.
you what, that blessed oil, I pour that in my water.
Get out.
Mother Sellers has
Heart
us
disease,
you.
praying over our
Thank
water.
you.
We pray over our water
HPV. These
every
are things
week.
that women need to worry about, not
I said
those other
women.
things.
I said
Wow.
as a
that you're
woman,
talking about.
I completely understand. But as a man, we pray over our water and we drink that. We get that blessed oil and we put it in the oatmeal and we eat that and we give
I'm
it.
moving
and we
right
give it
now
to
because
God.
a lightning bolt is about to come into this studio.
We give it to God. Oh,
No, don't
yeah.
touch me. Don't touch me. 'Cause you about to.
oh my goodness. Leave it to Mr. King.
We should close.
Thank you,
with
brother.
prayer.
And we should close.
Thank you for clarifying.
I had to say it. Cause everybody was acting like they were scared to say it. Let's just be honest, okay?
Oh man.
On the real,
We're winding down here, but
everybody needs.
do me a
to be
favor,
going to the doctor.
Juanica. Let's pass out your information one more time for me.
Okay. My website or my email address is Fernandez, FERNANDES @enrollamerica.org. And like I said, this weekend I'll be at the Take a Loved One to the Doctor Day at Butler Park, and I'll be there from 10 to 2.
At Barnett Park, you said, right?
I'm in Barnett, yeah.
Okay, I think you said something.
I
else.
said Butler.
You gotta say Barnett.
Thank you for fixing it. Barnett Park.
Yeah, them folks all on the east side of town.
Yeah. Is there a Butler Park? Really?
Probably it.
It
I was
probably
thinking about
is somewhere.
the beach.
Somewhere.
I was thinking
It
about
may not be
Butler.
in Orlando, but it's somewhere.
It's somewhere.
Okay,
but,
you
she'll
guys
be
go
at
to Barnett Park. I'm
yes,
sorry.
EnrollAmerica.org, right?
Yes.
Awesome,
sir.
man. We appreciate you coming by and giving us all that information. Thank you, Miss Burney, for bringing it down to the show tonight. We thank you for coming as well. We only got a couple minutes, and there's a story that I saw that I'd be remiss if I don't mention it. Happened up in Massachusetts. There's a family that is actually suing the school system because their daughter went to a school trip at a place called Nature's Classroom, and they basically offer these different experiences for the kids. The one that this particular school chose to be a part of was some kind of underground railroad event. And so as a part of the experience, what they did is they had all of the black kids pretend to be slaves, and then the people who run the event, who are white, basically treated them like a white person back in those days, in slavery days, would treat slaves. But the key here is we're talking about middle school students. So 12-year-old girl, 7th, 8th grade, something to that nature, field trip, Massachusetts, white people calling her the N-word, anything that you think they would say to a slave back in those days, that's what they were saying to her. But just thinking about this. So this is a organization. They get funded. I'm sure the school had to pay them to go there. And there's an underground railroad experience where you're calling middle school, and they do this for all ages. So, I mean, this was a middle school student, but they do it for elementary if that's what the school wants. They do it for high school if that's what the school wants. You know, and the school's basically picking the event that they choose. But seriously? 12-year-olds are pretending to be slaves, and then the white organizers of this company are calling them the N-words and any other kind of foul thing. Wow.
Bashfully.
Check it out, man. The place is called Nature's Classroom. The school itself was called Trinity College Academy, man. Crazy story. I can't even believe a company like that exists, where they would actually call 12-year-olds the N-words and pretend they were slaves. Like they need that experience. We want to thank you for listening tonight to the show Real Family Talk. Please follow us on Facebook, follow us on Twitter. Everything, of course, is Real Family Talk. Follow the website realfamilytalk.weebly.com, and we'll see you next week. This is WOKB 1680 AM, your urban empowerment and inspiration station. Thanks for listening. This is J Real.
WOKB, Winter Garden, Orlando.
It's Gospel 1680 WOKB, your urban empowerment and inspiration station. Jay Real and Company was in here doing the thing. Great topic, guys. I appreciate you. Thank you so much. Please continue to do what it is that you do. We're getting into the music right here. I'm